For a nice presentation. I'd now like to open it up for questions from the committee.
Thank you so much. I'm wondering how and when you use the NHANES in your work. Do you use it for benchmark? Do you look at it? How do you advise states when they're collecting their data?
Good question. We always look at the NHANES data because that is the gold standard at the national level for obesity and overweight. And what we're looking at are subgroup differences and trends. And while they're going to track at different levels, different cut points, so to speak, because ours are underestimated, we want to make sure that they're looking the same and heading the same direction, that we've got the same differences by subgroups, demographic subgroups. And the good news is that they do tend to run pretty much together. They're just running at different places. And to be perfectly honest, that's what happens with all household data compared to school-based data. So if you look at our sexual behavior data versus the National Survey of Family Growth, that actually just this week or last week published some new data on sexual behavior among kids. Our data are not at the same because kids in households are less likely to report than they are in schools. Household cannot be anonymous. Schools can be anonymous. And that the household setting tends to limit what some kids are willing to report. But again, the NSFG and the YRBS data, they track the same from a trend point of view, and the subgroup differences are the same. So we're real used to those kinds of differences between school-based and household, and there's just another level of that when it comes to school-based and NHANES, where we actually have the measured height and weight information at the national level. Does that help?
Yeah, very good. Thank you. And then on your sample, is it public schools? So are the private schools included or the charter schools? And then is there any effort or activity around getting students who have dropped out? So it's not getting maybe the highest at risk who have left school.
At the national level, it's both public and private schools. There's only a handful of the states that include the privates. Charter schools are included across the board. And these are school-based surveys only. You have to be in school to be part of the youth risk behavior surveillance system. So we are never suggest that these data are about adolescents. These data are about kids in school.
Yeah. And is there any activity to get those students or that you know of?
You have to go to a household survey. So both the National Health Interview Survey, the National Household Survey on Drug Use and Health, and NHANES, all of those surveys have access to kids that are not in school.
But that's not a focus of the youth behavior.
The youth behavior surveillance system is about students only.
Yeah. Okay, thank you.
Thank you so much, Laura. I wanted to build off of Lynn's question, which is how these schools are identified. And I think I heard you say that it does include private schools and charter schools, because we certainly have seen shifts in where children are going to school. Does it also include rural areas?
These are national samples or state-level samples. We start with a list of every school in the country or every school in Ohio.
Right.
And we draw probability samples of schools and probability samples of classes, or random samples of classes within those schools. So we're using scientific sampling selection techniques just like the household surveys are doing. No different whatsoever. We're just applying it to the school setting. And our samples are highly clustered as a result because we're sampling big hunks of kids in schools and then smaller hunks of kids in classes after that. That affects things like confidence intervals and design effects and those kind of things, but the sample selection process is as scientific at the school for school surveys as it is for household-based surveys.
Right, good. And what would you say, after working with these data for such a long time, what are the challenges that you have identified?
Challenges. School-based surveys are unique in the sense that there's a whole lot of gatekeepers before you get to your respondent. And we've got to work through each of those levels of gatekeepers to keep our response rates up high enough levels to have high quality data. And that's probably our biggest challenge. We start with state boards or state education agencies, superintendents of schools, some of which are elected in some of the states in this country. Not all of them, but some of them are. We then have district superintendents and district school boards to deal with. And then we get to the principal. We've got the teacher, who is the one person in all this that rarely has a choice but may have a real attitude one way or the other about the goodness of a survey like this. We've got the parent, and then we finally get to our respondent, which is the student. So those are all the different levels we have to work through, and that remains a challenge. And it's why we see states coming in and out with weightedness cycle to cycle. Some places it's very institutionalized in some of our states, but we've still got a handful of about 10, 15 states where every year it's a real adventure. And whether or not they achieve, make our mark for weightedness or not is something that they work very hard on because it's not at all assured. So it's that whole clearance thing and the fact that we are so far away from our actual respondent that is probably our biggest challenge.
Thank you.
Hi, Laura, thanks a lot. I want to echo that. Having done a lot of school-based surveys, it is kind of a uniquely challenging, but also can be very rewarding phenomenon. I have two questions. The first is a very minutiae, detailed one. So given what Cynthia mentioned about the issues of biologically implausible values, I noticed that you said you edited the YRBS edits out biologically implausible values. So I'm wondering if you could share with us what your algorithm is for determining when something is biologically implausible and why the decision was made to remove those data points as opposed to let people just have their own sort of algorithm. And then I'll get to my second question after that.
All right. I don't know it off the top of my head, but it's something I can send back here, and I will do. And we did it because we thought there might be some really crazy values. And I will not only send the algorithm, but I'll send how many of those we find on your average national sample so that you get a feel for what we're losing. That's something we can count.
I have a follow-up question, if you don't mind. You mentioned the nationally recommended sample. Did you do the same data cleaning for the state and local data that you do for national
Yes.
data?
Yeah, and again, it's part of the system, so we handle all the data the same to maximize the comparability. So the cleaning, editing, weighting process that's done at the national level is the same cleaning, editing, and weighting process that's done for the city and state samples. Because, again, remember, one of our purposes was to provide comparable data sets from different populations of kids. And so one of the things we want to take out of there is anything that might make them different. And data editing and cleaning is one of the places we can be very lockstep, and we are.
Well, it's interesting because I know that you have the surveys are available free and online as guidance to school districts about how to do their own YRBS. And I know that I've worked with school districts where they're not part of the national survey, but they do their own, and they've been doing their own every year. And I don't know that they do that same kind of. They don't have that kind of editing. So that's why sometimes I wonder whether the sort of local level data may differ, how it relates to the state. Well, if it's larger, if their prevalence is higher, if they're not editing out the biologically implausible values, I'm just wondering if there's potentially some sort of skew to local data sets as compared to national and state level data sets.
The quality of sites that are, well, let me back up. The state and local surveys that we support and provide technical assistance to are all done the same. So that's the 47 states and the 21, 22 large cities. Those are part of the system. Now, we do make available the questionnaires online. There's some guidance online if you want to do your own thing. And those folks are on their own. We don't have the resources to be involved in those surveys at all. So some of those are probably done very well, and some of those are probably done very poorly. And we have no control at all over that whatsoever.
Okay. Thank you.
So you may not know this, but are there people who are working on how to get better self-reported estimates? So I'm thinking, like, if you're in the classroom and height's a problem, like maybe you'd have a height scale on the wall that that students could look at or go up and measure, or some kind of methods to improve self-report, and both height and weight.
Right. It'd be great if we could weigh and measure the kids before they actually took the questionnaire.
Yeah.
And we don't have the resources to do that. We might at the national level. We definitely don't at the state and local level. And we're less interested in it at the national level, to be perfectly honest, because there's other national data sources.
Right.
We're particularly interested in the state and local, and that's where the resources are very, very slim. We're doing the state and local surveys for about $100,000 a survey. Which is one of the great things about school-based surveys, is that they're very cost-effective, but it means there's almost nothing left as far as additional resources are concerned. So we've talked to some states about trying to implement some of those kind of tools in the classroom, and we just haven't gotten very far with it at this point. It'd be a
So-
great recommendation to come from you all,
Yeah,
but
yeah.
I don't know how many legs it would have underneath it. to
So in
actually
your
see it
group,
happen.
you're not doing kind of primary research on how to ask questions or better ways to get at self-reported, or where to put them in the survey, or order?
We haven't looked at order. Right now, they're question 6 and 7 because we
Yeah.
want them right after the demographic questions,
Yeah.
because those are the ones that people can't change. Everything after that can move.
Yeah.
And the way we set up our answer sheets is we need those height and weight grids in a standard place. And that's
Yeah.
what's driving the placement right now. So we have not looked into
Yeah.
placement at all.
Or how about how you ask the question? I know with your survey, it's maybe difficult to change the question, but is anybody doing research like, what is your weight when you were last at the doctor, or were you in the doctor in the last?
We
Does
haven't
it-
looked at any of that.
Is there a place that does that kind of research and work?
Not that I know
On
of.
self-reported weight and height? To
I don't-
improve questions and, yeah, okay.
I'm not aware of that, no.
Thank you.
Hi, just to follow on that question, is there any thought of possible linking to the student health service or the school nurse for heights and weights, or other kinds of medical data to get heights and weights?
Not from an anonymity point of view, no.
Okay.
We do have a global version of the YRBS, and we do actually, we have the resources there to put, to actually weigh and measure the kids before we do the surveys. But we found we actually had to do that on the international setting. The surveys are only done in developing countries, and the kids have just no clue at all in those settings. So we were getting just tons and tons of empty answers, non-response. And so just to have any data at all, we now are paying for the measuring of the height and weight in the international surveys, but we haven't done it here yet. Yeah.
So my question is, so this is a surveillance. So do you have like this each year, same school, same student answer the question? I guess I meant, are these a longitudinal data?
These are all cross-sectional samples. This is
Okay.
not longitudinal. We're not following the same kids or the same schools. It's cross-sectional data, just like NHANES and the other national surveys.
Okay. So I saw on the slide you have collected the cigarette smoking information.
Mm-hmm.
Are those regular cigarettes, or do you have any e-cigarette in there?
Uh-huh,
Oh,
we do,
great.
yes. And we also measure smokeless and cigars. Thank you very much.
Thank you so much.